Hello everyone, my name is Mohamed Janabi. I'm a cardiologist here in Muhimbili National Hospital. So I'm standing in front of our CT scan. It's 128 slices. And why a cardiologist is standing in front of a CT scan? So this CT scan is the one which does CT-Angio. It's a study of the blood vessels of the heart. So there are two steps which we do here. Normally, and it takes very few minutes. In the past, we used to do nuclear stress test, which is not necessary now because it uses a lot of radiation. So in our hospital, we use a CT-Angio. And these are the patients who are intermediate. They are not at a very high risk or they are not at a very low risk, presents with chest pains. We can put them. So the first thing which we study in the vessels is the calcium score, because once you have a lot of calcium in the blood vessels, it's a risk factor to get atherosclerosis because accumulation of calcium is equivalent to atherosclerosis. So they can get plugs and you get an obstruction which you can get a heart attack. But the other thing which we do with the machine is to inject a contrast which goes to the blood vessels of the heart called coronary arteries, and we study the arteries, whether there is a blockage or there's any defects on the valves, if there's any clots in any of the chambers, whether it's the right ventricle or the left ventricle. And the other thing which we look is on any congenital abnormalities, and we look on aneurysm also, the dilatation of the vessels. The other advantage of this machine, we can see the skin or the cover of the heart, which is called pericardium, if there's any inflammation occurring on the pericardium. So it's an excellent machine with very minimal radiation, so it's pretty safe. And we have it available here in Muhimbili. And we do have specialists, radiologists who can do the interpretation and do the procedure. So it's another service. We thank the government for massive investment like this. So it's not necessary for all the patients to use the old method of nuclear test. Thank you.